IBS can actually happen to anyone.
Yeah.
So that is a myth, actually. The reason to say that is a lot of people have heard say that only women have IBS. Yes. I don't know why.
That's what I was asking you.
A lot of people say that, like, a lot of women, only women will have IBS, but it can actually happen to anyone of any age group. It does not pick and choose. IBS can be cured. So why can I not get treatment for IBS? You know,
IBS it's not a real disease. It's an intolerance.
Or it's in your head.
It's in your head.
To Consultation Room Podcast.
Hello, and welcome to today's episode. On today's episode, we're going to delve into the complexities of IBS. As one of the most common gastrointestinal conditions, IBS affects millions of people worldwide, and it brings about a lot of challenging symptoms. So on this episode, we're going to talk about what IBS really is, what are the management options for IBS, and what is the current treatment for IBS. So let's get started.
Fantastic. Today I wanted us to actually go straight into one of the myths about IBS. So one of the myths that I found out is that some people think IBS is the same as IBD, and sometimes it can progress into IBD. So I wanted to just start off with that.
Mm-hmm.
So just to break the ice, IBD, which is inflammatory bowel disease, is different to IBS, which is irritable bowel syndrome.
Yeah.
And IBD is basically when you have the inflammation of the GI tract, your gastrointestinal tract, and whereas with IBS, it's totally different.
Yeah.
So IBS, as Trudy said in the beginning, it is a chronic condition, often debilitating function of the GI. And in IBS, it usually involves the function or the movement of the bowel, which is not quite right.
Yeah.
So that's when this actually brings on some symptoms.
Mm-hmm.
So you may find out that you may be experiencing symptoms such as abdominal pain,
Mm-hmm.
spasms.
Mm-hmm.
So this is all to do with the movement of the bowel.
Yeah.
And that's what's bringing out the symptoms. So that's how you can differentiate between these two diseases.
Yeah.
When it comes to the symptoms, there are different symptoms, and everyone is different.
Mm-hmm.
So the common symptoms that you may notice, which I've already mentioned, is the abdominal pain, the stomach cramps, the spasm.
Mm-hmm.
Some people often get flatulence as well with IBS. And you may either get constipation or diarrhea.
Mm-hmm.
So sometimes we differentiate it. We say IBS with constipation, IBS with diarrhea.
Mm-hmm. Or
in some cases, it actually interchanges where you may have both.
Mm-hmm.
Yeah, so there are different symptoms. Some other symptoms as well, which are not too common, is passing of mucus in the bowel,
Mm-hmm.
Which can often happen. You may get some bit of tiredness,
Mm-hmm.
lack of energy, because you can imagine how you feel when you have all of these symptoms going on. But another common one that usually happens
Mm-hmm.
is bloating. You may find that your stomach feels really bloated,
Mm-hmm.
like a bit of a pouch.
Yeah.
It's all to do with the movement of
Mm-hmm.
the bowel, the way the bowel is placed and stuff, and that's what causes it. Sometimes with IBS, it can actually affect the frequency of your bowel movement as well.
That's it. Yeah.
So you may be either having diarrhea a lot more,
Mm-hmm.
or having constipation a lot more, or it could be less. So it does affect the frequency of your bowel.
Mm-hmm.
And when it comes to the symptoms as well, it is a chronic condition.
Mm-hmm.
But some people, it may last for days. For some few days, some people, it may last a bit longer.
Mm-hmm.
And it could last for some weeks. But each person is different.
That's it.
And over time, it may subside, but when it comes to it, we don't. It is a lifelong condition. Basically,
it
is a lifelong condition.
It is. Also, just to add on something you've said, so you know how it can affect both sort of like your bowel movement. So you might find that you have a bit of diarrhea or constipation. There's something they call bowel incontinence.
Yes.
Where you could just have diarrhea all of a sudden.
That's
you can't control it.
Yeah.
And I think that is quite sad because when, let's just be honest, in society as we know it, something like that, someone will be like, oh, like, you know, like they're just, you know, they've got loose bowels, you know, but it's a condition that someone has and they can't help it. That's it. Yeah, definitely.
Okay. So that is how I would differentiate what IBS is. But what would be like the causes of it or the triggers when it comes to IBS?
I think the cause of IBS is not really well understood. So there isn't anything in particular that we can pinpoint to and say, this is the reason why you have IBS. So there isn't a specific cause for IBS. And as I said, it's not well understood. So it's something that we're still trying to understand every day. And also triggers might differ with everyone. So what could be a trigger to someone might not be a trigger to someone else suffering from the same condition, which is IBS. So there is different triggers. Mostly, I think mostly food, let's be honest. So food stress can actually trigger IBS as well, but mainly food. So knowing foods that can actually trigger your IBS, so that might cause you to be constipated or might cause you to have a bit of diarrhea, maybe that flatulence, the bloating, maybe cause that mucus. So some foods can be a trigger, and they can cause you to have the symptoms of IBS. So just very commonly, I think some people, I have a friend who has IBS. Yes. And how I found out she had IBS, well, I say she's a friend now, but how I found out was we were at work. This is at work. She's my work friend. We were at work, and I must have been going to Costa to get a coffee. And I was like, oh, do you want a coffee? She's like, I can't have one. I was like, oh, why not? She's like, oh, I can't have got IBS. I was like, oh, I'm ever so sorry. And she basically went on to, like, you know, with us talking and everything, because there's a lot of things that we would even bring about and she would not have. So coffee can actually be a trigger for some people. A lot of people who have IBS have that as a trigger, but some people with IBS will have coffee and they'll be fine. I think even some brands of coffee as well. Yeah, but also dairy.
Yes,
so
that's a common one.
Exactly. It could mean that maybe they are affected by milk products, maybe cheese, things like that. So you might find that maybe a lot of IBS patients might go for like the non-dairy alternatives. So oat milk, soya, the likes of almond milk, coconut milk, because dairy just does not do them any good.
That's right.
Exactly. There's just different kinds of foods that that a lot of patients who have IBS would basically cause them to have the symptoms. Just any others would probably be things like alcohol. So some people with IBS consuming maybe a little bit too much alcohol, even actually the slightest bit of alcohol might cause their IBS to flare up, or even any fizzy drinks. So a lot of people with IBS, they can't have like a can of Coke or like a can of, I don't know, Fanta or whatever, because any fizzy drink. So how you can go and get a 7-Up, they might not really be able to do that, because that will cause them to have a flare up or flare up their IBS.
That's right.
But that's just some of the food triggers. But a lot of other things can actually trigger their IBS. So stress is actually very, very major. Yes, a lot of patients who have IBS, whenever they're stressed, they start having some of these symptoms.
I see that a lot. That is one thing that I say is very common when it comes to the IBS patients.
Exactly.
Very, very common.
Stress. I think stress is just terrible for everything.
It's so true. Honestly,
stress is just
calm, guys.
it's
easier said than done. But
but if if you suffer from IBS, honestly, try avoid as much of stressful environments as possible, or anything that causes you stress, cut it off, because it's only going to make your IBS worse. I can't think of any others. Any other main ones that you can think of?
I think you said it all. Like as Trudy mentioned, IBS, there's no exact cause for it. It's just little things that play like a role in it that can trigger it. I mean, some things that I came across, basically, it's just like your what goes inside your body. So basically, muscle contractions of the intestine. So if like you have like a dysfunction of that is gonna play a role when it comes to like triggering the IBS. But you can't help that. These are just like things that are happening inside your body.
That's it.
So it's a nervous system, so maybe like the signaling going on like in your gut to your brain, so that could be a trigger to your IBS. One thing I also found out, severe infection apparently can be a cause of
IBS. Okay.
Could trigger
IBS.
Okay. Yes. IBS. Because you know, when it comes to infection, sometimes it can travel to the gut area, and then it can, you know, change the environment in the gut, and that 100%. Could basically trigger some symptoms that you're not wanting. Again, changes in gut microbes, which is linked to, I guess, severe infection. But these are just little factors that can play a role in like triggering your IBS. But as Trudy mentioned, literally there's no cause for it. It's just a matter of knowing what is causing, like what is triggering your IBS. That's it. And the main things, as you mentioned, is just food and basically your mental health, stress, anxiety, that sort of thing. And also just understanding that IBS is not really anything wrong you're doing. It's just because your gut and brain interaction is slightly malfunctioned. So what you're eating is not necessarily being I suppose that is not being controlled by the brain, or the signals are not being sent to the brain enough to sort of like accept it. So the brain is like, hold on, what are we having here? You know, we're not having this. So that is kind of what IBS, how it works. So it's not anything you've done wrong. It's not like anything that I don't know, you went skiing and you were in a cold environment and that caused IBS. There's not really anything like that. It's just that signal, because the body is a machine. It is a machine. So if you're sending a signal to a certain part of the body and there's a block, you know, on that part, your body is almost not taking that signal. So it's almost like sending the signal back, like, no, we're not having this. So it's exactly the same kind of, I would say the same concept, isn't it? So there's no one thing that causes IBS. It's not well understood. So hopefully, you know, the same way there's a lot of research going on with a lot of conditions, we'll eventually come to what causes IBS, and maybe that way we can avoid it. So we have talked about the symptoms, and we've also talked about the triggers and what IBS really is. But what is the management for IBS? What I would advise is, when it comes to the management of IBS, is usually basically watching what is triggering your IBS symptoms. That's it. That is the main thing. The only way like you can manage a symptom, you can manage a disease, is by knowing what is causing it and basically tackling it. So if it is like food that is triggering your IBS, avoid that food. You know, if it's that dairy product that is causing you to have those symptoms, why eat it? You know? Okay. So I would say do that. Another way, apart from dieting and lifestyle, I would say drink plenty of water, eat regularly, because sometimes I feel like the time as well we eat can affect your IBS. So eat regularly, eat enough, or don't eat too much. Just watch those sort of things. So when it comes to like food triggers, just watch all of those things. Again, exercise, because exercise is good, you know. Exercise is like one of the main things that help manage a lot of diseases. That's so if you could do that. And one thing I would say, manage your stress. easier said than done, but it is very important.
Yeah.
Because as we already know, stress is a major trigger for IBS.
That's it.
When it comes to drug therapy, there are some medications that can help manage your IBS.
Yeah.
So what I would say is that when it comes to the drug therapy, just check what your symptoms are. So if your IBS does come with diarrhea, I would treat that symptom with just anti-diarrhea or like just the way you would treat yourself if you had diarrhea.
Yeah.
If your IBS does come with constipation, again, treat yourself like the way you would treat if you had constipation. So maybe buying some, getting some laxatives to help, manage that constipation. But do watch some laxatives. I know there are some laxatives that can maybe worsen the IBS treatment, IBS symptoms, because there's some laxatives that can, the bulk form in one, it may be a bit too much, and that it will cause a bit of diarrhea.
Yeah.
So if you are having like diarrhea and stuff, so just be a bit careful.
Yeah.
But it's just literally trial and error and seeing what works. So treat your constipation if you are having constipation. Treat your diarrhea if you are having diarrhea. When it comes to the spasms and the abdominal pain, we do have some over-the-counter remedies that are available, such as Buscopan. These are anti-spasmodic medications that help reduce the spasm, the bowel spasm, and therefore reduce the pain that you may be having.
Yeah.
I don't know if you've heard. Some people also use peppermint oil.
Oh yeah. Peppermint oil capsules as well.
Capsule,
Yeah.
It does help. Especially if you're having bloating,
flatulence, even sometimes constipation, diarrhea. Yes.
Peppermint oil helps that.
That's.
I don't know if you've heard this one as well. Some probiotics.
Yes.
Okay.
Yes. Probiotics does help with IBS, or at least with some of the symptoms of IBS.
That's right.
Yeah, because it's helping with the gut, making sure that the environment in the gut is all good. Yes, definitely probiotics.
Yeah, probiotics. The other thing I would say, let's say for instance you are getting some pain with your symptoms. I would say maybe getting some pain relief. Just, to tackle that pain. So pain relief could be anything ranging from literally paracetamol to anything that you may have to go to your doctor for, maybe a higher opioid or something.
Yeah.
You could also, your GP may also opt for an option of antidepressant. So antidepressant, there are some antidepressants that help as pain relief. So you may find out that, I have IBS and I'm on antidepressant. It doesn't mean that you have depression, but this is to help with the pain, and also some antidepressants help with constipation.
Yeah, and some of the IBS symptoms.
Yes, and some of the IBS symptoms. So you may find out that you have IBS and you're on antidepressant, but those are the common things.
Yeah.
When it comes to I have some general tips.
Okay.
It's just some home remedy stuff.
Okay.
I usually say if you have IBS, you should opt more for fresh foods.
Yeah, you should cook at home.
Literally cook at home.
And my friend does that. I told you I've got a friend, so eating out is no for her. She cooks her fresh meals at home, and there's specific foods she can cook at home, and there's foods that she will not have. Yeah. Yes, most certainly.
With that.
Yeah.
Because a lot of the times I find out that when you eat a lot of takeaways or the
spicy processed foods,
the processed foods, and that really triggers people's IBS. Because of some of the ingredients in there. So I would say really avoid processed food, a lot of fast food. If you could cook at home, honestly, homemade food, homemade meals. All the way.
Because also I feel with homemade meals, you know what is going in the meal.
Exactly.
So when you're eating out, as much as we like a takeaway or eating out because you don't have to worry about cooking or cleaning. The only wrong thing with that is sometimes you don't know what is going in the foods.
Exactly.
So say if you have an allergy, you're not sure how the food is prepared. So you can't be guaranteed that your food will have won't have the things that you're allergic to, for instance. Or in this case, the things that might be a trigger you're not sure that that is not in that meal.
Yeah.
So yes, eating at home or making meals at home is the way to go when you have IBS.
Yeah. And my number one when it comes to like managing your symptoms is literally keep a diary.
Food diary.
Keep a diary of what you're eating
That's
and what
it.
is causing your IBS. Because that's the only way you can know what your triggers are.
What you reacted to, what caused you to have a symptom, or
So I would say that is my main tip.
Yeah,
literally my main tip.
They also say if you eat too quickly, you shouldn't eat too quickly with IBS. Take your time. Chew your food slowly. Like, just take your time with your food. Eating too quickly is not. It's almost like, as we said, there's that sort of malfunction between the gut and the brain, right? So the brain has not quite understood, wait, is this food coming to me? And why is it coming at this speed? So you need to take your time, eating a little bit more slowly, making sure, you're taking your time to chew the food, not swallowing before you chewed your food, because digestion starts in the mouth. So yes, eating too quickly is
I think that is spot on, like literally spot on, like, because growing up, literally, our parents used to say that take your time and eat, like, take
chew
your
food.
Chew your food, because it really does affect your gut. And very spot on.
I think also one thing that a lot of IBS patients might not know is you can't overindulge in certain foods, even if they're healthy foods. So if you have diarrhea as a side effect, you can't overindulge in the fresh veg and the fruits, because that's a lot more fiber, and what's going to happen is you'll just keep having that diarrhea. So they say, I think for an adult, 80 grams of say fresh fruit is enough, and maybe 3 portions of that is enough. So having more than that, so if you're having more than the 80 grams, that's probably a bit too much. And also just overindulging in maybe tea or coffee. So even if you have, say, your non-dairy milk, so you've used your oat milk or your almond milk or your coconut milk, and you've used just the right amount of, that doesn't cause you to have a trigger, but you're having it too much, that again is not going to exactly. So at work a lot, unfortunately, in pharmacy, we drink a lot of coffee. So if you
I don't
no, but a lot of people in pharmacy, let's be honest, in pharmacy, there's always a round of coffee going around. There's always someone coming, take coffee, do you want to, you want to brew? So you will find that at work that might be a little bit more difficult, but it is better for you to avoid it and then not to suffer at home alone. And overindulgence in tea or coffee definitely causes you to have causes the symptoms of IBS to be a bit more elevated. I think they also say that you should not skip your meals. I think you've said that anyway. So skipping your meals is really bad for IBS. So as you said, having meal times and adhering to these meal times. So if you're used to having your breakfast at 8, your lunch at 12 and your dinner at 5, make sure you stick to that. I'm not saying at 8 sharp. If you're somewhere you have to go home, but within that window, try not to skip any meals, because again, that is only going to cause you to have the IBS symptoms. But definitely, I think the home remedies are good. Some home remedies are good.
It's the main thing, really, if you think about it. If like food is like the main trigger for it, that is what is gonna help.
And I think they also say try avoid foods that are hard to digest. And a lot of the healthy foods, unfortunately, can also be quite hard to digest. So cabbage.
Lately, a lot of things are very hard to digest.
But there's things that you will know that within sort of like your everyday meals, you'll know that this is quite hard to digest. So things like, let's be honest, like as much as we love the greens and the fresh fruit and the fresh veg, something like cabbage is actually quite hard to digest.
It really is.
Yes.
Like, cabbage.
And I mean, and cabbage causes a lot of the other things we don't like. So flatulence.
Cabbage. Oh my goodness. Cabbage, cauliflower.
Cauliflower, cabbage, broccoli as well. And also anything with sorbitol. So avoid sorbitol. And sorbitol is in a lot of
diarrhea,
and it's in a lot of foods and drinks anyway now. So
or even like even medications,
Yeah,
you know.
yeah. So also when you're having medication, just maybe if you're having you've started a new medication and you've noticed that maybe you're having a lot more of your IBS symptoms, just double check the ingredients in your medication, because that could be the reason why you're actually having.
That's right.
Yeah, you're having the symptoms. So do have these conversations with your pharmacist whenever you're collecting your new prescriptions. If you have any conditions, so if you have IBS, IBD, whatever conditions you have these conversations with your pharmacist. Just let them know that you have a certain condition, because we normally check what we call contraindication. So some medication are contraindicated to certain groups. So if you're within that group, we will most likely not let you have that medication. Instead, we will discuss with your doctor what is the alternative medication. Yeah, definitely. I think we've talked about pretty much everything. We've talked about what IBS is. We've talked about the side effects, management. We've also talked about some home remedies, which is good.
Exactly.
Yeah. One thing though, we've said that a lot of it, let's be honest, a lot of it, because it is not well understood. It's not really a treatment that you can get, a condition that you can get a treatment from your GPs from. We will most likely have a lot of medication in the pharmacy that you can take, and that will help treat some of the symptoms. So as you've said, constipation, diarrhea, flatulence will have some of this. And of course, if it's quite debilitating, you might get something like, as you said, Steph, antidepressants from your doctors. But there is certain times that maybe you should go straight to the doctors and not come to us. Yeah. So these are sort of the red flags, we always call them, isn't it? Yeah. So there is normally some red flags with a lot of medication. So if, say, you suffer from IBS and you notice that you're losing a lot of weight, that is definitely a red flag.
With anything, if once you see that you're
weight
losing
loss,
weight, especially rapidly, and you cannot explain it, please straight to your doctor,
or even your emergency services. You know, if it's a weekend and you're having constipation, it's been going on for a while, and you've just noticed within that week, for instance, like some people lose so much weight within a week. You've noticed that, oh my god, I'm losing so much weight. Just go to your as we said, to your GP, if not even your emergency services. Just go get checked.
That's right.
Any others you can think of?
I would say the common one, which is like passing blood in your stool.
Blood in your stool, always.
Like, that is something that you need to go straight to your GP for. I would definitely put that. Because blood is very serious. Like, even when you see it in your nose or something, you get you get really worried. So
that's it.
In your stool, definitely go straight to your GP. Especially when it comes to weight loss as well. Blood in stool and weight loss, those two especially together,
that is a sign.
That is a concern. So please go straight to your GP so that they can investigate what is going on.
That's it. And I think also any sort of hard or lumps in the stomach or abdomen, if you start feeling like there's a lump there, there's a hard lump there, there's a swelling in your stomach, go to your GP. That is not even a thing that you come into pharmacy and we give you something for. No. There needs to be further tests. You need to go to your GPs. They need to do some tests to make sure that, okay, this is not just IBS, or if it's IBS, okay, there's no other organs that have been, affected. Exactly.
I would also say, if like your bowel habit has changed and has been there for like 4 weeks, like that change has been going on for so long, especially like if it's been there consistently for like 4 weeks, like whether it's diarrhea or constipation, but any changes in your bowel habit that is not going for a couple of weeks or so, please see your GP. I will put it that way.
No, definitely. One last thing for me that I feel like, okay, if you have this and you have IBS, go to your GPs, is some people experience palpitations. So if you have any palpitations or shortness of breath, or even you notice that maybe there's your skin is a bit pale, so there's that paleness in your skin, go to your GPs, because this could actually indicate something a little bit more serious. That honestly, if you come to the pharmacy, there's nothing we can do to help with that. But definitely, the reason we say go to your GPs is because they can do the tests just to make sure, okay, what is exactly going on here, and then they can treat exactly what needs to be treated.
I wanted to ask you, do you know, because some people would want to know, who normally gets like IBS? What are the risk factors? Is there like a particular group of patients that usually get IBS, or it can literally happen to anyone?
Okay, IBS can actually happen to anyone.
Yeah.
So that is a myth, actually. The reason to say that is a lot of people have heard say that only women have IBS. Yes. I don't know why.
That's what I was asking you.
A lot of people say that, like a lot of women, only women will have IBS, but it can actually happen to anyone of any age group. It does not pick and choose. Like you're female of a certain age, you will, because it's normally like, it's not even like younger girls. It's normally a lot of older women that people have this assumption that they will have IBS, but literally of any age, it does not pick and choose. You can have IBS at any age, or any race, any gender, you can get IBS. But it is actually mostly, or it's commonly reported in women.
That's right.
I suppose it's mostly because women, when we have something going on, we go to the doctors.
We say it.
Yeah.
We're not like men where we keep it to ourselves.
Yeah.
Like,
And I think it's not even that. It's mostly because men don't like going to the doctors.
Yeah.
So I feel like you will have this side effect. You'll have this symptom and you will just go to the pharmacy and say, oh, I have a bit of diarrhea. And you'll just be taking for so many months anti-diarrhea medication. Whereas there could be an underlying cause. Whereas a woman will be like, after 1 week, they're like, no, GPs need to check what is going on. So it is mostly reported with women, in women, but it can literally affect anyone of any age, any race, any gender. I totally agree. IBS, literally, there's no group where it says, no, you're in this group, so you're gonna get it. As you mentioned, common in women, common in young people as well. But you can have it in your adulthood and stuff. But these may be risk factors, let's put it that way. If you are young, if you are female, that's it.
But one thing, if there is like a family history of IBS, it is a risk factor that you may also develop IBS.
That's true.
And also another risk factor is that, let's say for instance, you have any like mental health history, or you have like anxiety, a bit of like depression. These are risk factors only because of the way the IBS symptoms work, in terms of like the function, the stress, like the triggers of it.
That's it.
So like these are risk factors to develop an IBS, I believe.
That's true. That's true. I don't know if you've heard of psychological therapies. Yes, for IBS. Because as we've said, IBS can be caused by stress and anxiety. So sometimes GPs might refer you to someone to have these talking therapies where you somehow talk through your stress or anxiety, maybe go through what is causing you to be stressed or anxious, and that could actually help relieve your IBS. So as much as we've mentioned the medication, things to help with diarrhea, constipation, flatulence, and as well as antidepressants, which can help with IBS symptoms as well as help with the pain, there is also talking therapy. I am an advocate for non-medication treatments. So if you can avoid medication, I know I'm a pharmacist and I am, basically a drug dealer for lack of a better word, but if you can avoid taking medication, because what happens, let's be honest, with medication, there is side effects. And with the side effect, you're likely to take another medication to help with, treat that side effect. And it becomes a vicious cycle. So personally, I would always advocate for non tablet or medication treatment. So, talking therapies are medication, but it's a different kind of treatment, isn't it? But if you can avoid taking the tablets, the capsules, or the just the medication, really, and just try some of these other things like the lifestyle. So we've said things like exercise.
That's right.
Talking therapies.
I like home remedies. I always do.
Yes. And honestly, some of these things, because it's all about a lifestyle change. So for me, more than anything, is that lifestyle change. It's just changing that lifestyle. So anything, if you find like, let's say, doing something causing you so much stress, changing that lifestyle altogether. Or if you notice that maybe when you exercise, it helps with your stress levels, maybe you need to exercise a bit more. So things like that can actually help with IBS. And support groups. There's a lot of support groups now. So check your area, your local area. They'll probably have a group for IBS where people come together and they all talk about what's going on, and that will certainly help with IBS. Yeah. So you did start by talking about myths.
Yes.
I'm sure that was not the only myth about IBS. There's always so many myths with IBS.
There's always so many.
Yes.
Yeah. Let's just start off with like the simple one as well. I think some people say like, you know, IBS it's not a real disease, it's an intolerance.
Okay. Or it's in your head.
It's in your head, yeah. It's not real. It's in your head. Like, it's just an intolerance. It's like...
It's as real as it comes.
It's real. It's a real disease. It's a real disease. I think that's something that people need to stop, because with IBS, it can literally be debilitating, that it can affect your quality of life.
It can.
It really can. It is a real disease in terms of like it causes all these symptoms as well. So how can you say it's not real? It's not an intolerance because you're not really allergic. Or it's only because like food...
things are triggering it.
Yeah, food is triggering it.
Yeah.
So that doesn't mean that you're intolerant to it.
It's like asthma. Cold triggers asthma, but you're not allergic to cold.
Yes.
Yeah.
Basically. So when it comes to that, I think we need to debunk that. That is, it's as real as it gets.
That's it.
It literally affects people's quality of life, and it's so sad. Like, you see some people, they're not able to sleep. It's so bad that they're not even able to eat properly.
Yeah, enjoy everyday life. You know, like when, let's say, like for instance, like on a daily basis, someone wakes up, they go to the coffee shop, they get a coffee, and then they will go. I don't know. They'll even get a pastry with it. They'll meet friends for lunch. Someone with IBS can't actually do that. You know, they can once they've sort of known what triggers it, but it's a lot to sort of work around. So it is a real thing. It's as real as they come. Yeah.
So that's one thing I would say.
No, that's good.
That's not true.
Yeah.
It is a real disease. It's not an intolerance.
No.
You know. What other myths have you come across?
I've heard that someone has said that IBS can be cured. So why can I not get treatment for IBS? You know, they say, why can I not get the treatment for it? You know, to completely cure and treat IBS. You know, like the way you can, I don't know, you can have something going on, like a stomach bug, and then you can have something for it, and that clears it. Why not for IBS? So someone has said that it can be cured, and unfortunately, that is false.
That's false.
No,
you can't cure it.
No,
you just
can manage the symptoms.
Manage the symptoms. But doing your diet and lifestyle changes, just checking what is triggering it. That's it. That would help you control it better, help you manage the symptoms. Yeah. But in terms of like curing it, where like it completely goes, no, it's not. Yeah. It's not right. No, you cannot cure it. This is a lifelong disease. It is. It's just about literally learning how to manage it. Yeah. That's it. And trying to avoid your triggers. Yeah.
I think we've the only other ones I've heard is the two, which is people say only women get it, which is as we've said, it's not correct. Not just women will get IBS. It can affect anyone of any age, any gender, any walk of life. Basically, IBS does not pick and choose. Like, you look like you could be okay with IBS. No. It can affect anyone. I think part of it also is just hormonal difference, isn't it? So women might, as we said, we are more likely to go to the GPs, and then they are likely to tell us, okay, this is IBS. Whereas for men, they will say self-medicate or come into pharmacy and just get something to just relieve some of that symptom. They will not really get a diagnosis of what is going on. It's just the way we are, but also just hormonal difference. As much as we're all humans, we are very different. The chromosomes are very, there's X, Y, and XX. So it is all very different. And I think that forms a big part of why some things would affect some certain people more than it would others. Or maybe even just why some people are slightly different. I.e., women are very, different to men. But unless you have any other myths that you've heard of?
I think I have heard other myths, but we've tackled them already. Like the other myth was just you can't eat or if you cut down like gluten and like dairy, that means that you're not like you can get rid of like your IBS symptoms. But somebody can cut down like dairy and like gluten, but they'll still have their IBS symptoms, because that is probably not what's causing their IBS symptoms. So again, just it's not a general advice for people saying, oh, cut down gluten or cut down dairy and that will solve your IBS, because everybody's different. Your triggers may be different. And just because like food is a trigger for your IBS doesn't mean that you can't eat. You can eat. You just need to watch what you eat basically. So.
And I think that's a good point, because when it comes to IBS, as you said before, you could have constipation or diarrhea, or you could have both, or you could have them interchangeably, where you have constipation for the longest time and then you're good and you start having diarrhea. So the things that were causing you to be constipated is probably not even your trigger anymore. And now something completely new is triggering your IBS, and you're now you're having diarrhea. So it's just knowing and identifying, as you said, Steph, the best and I think the most practical way to manage IBS is to have a food diary. Have a food diary, and every time you will know what it is that is affecting you, what is triggering your IBS, and then you'll try to avoid it, because all of this will change as well. The body changes as well, let's be honest. So just having a food diary is very important in knowing, when it comes to triggers, especially food triggers, what is causing your trigger with IBS. What's your take home for IBS?
Okay. My take-home message when it comes to IBS, it is a common condition that affects your digestive system. As we said, it is a real disease. It is something that is affecting a lot of people, young, old, female, male, regardless of who you are, it does affect them, and it does affect people's quality of life. So please do not have that stigma that oh, this is not a real disease. It is a real disease.
It is.
And when it comes to IBS, watch your symptoms. So symptoms such as like stomach cramps, bloating, abdominal pain, diarrhea, and constipation. These are all symptoms of IBS, and they tend to come and go over time, and can last for days, weeks, months, or like at a time. But it is a lifelong disease. It is a lifelong disease that we cannot cure it, but it can be managed. It can be managed by knowing what triggers it. And your triggers could be food, could be stress, could be anything. But once you know what your triggers are, you can help control your IBS and have a better quality of life. When it comes to treatment and management, as I said, my number one is keeping a food diary, just to know what is causing, what food may be triggering your IBS. And by knowing that, I think you can live a better life, really. And as Trudy mentioned, there are some drug therapies, but make sure you do your non-drug therapy first before going to the drug treatment. And when it comes to drug treatment, just tailor your symptoms to the drug treatment. If it is diarrhea, treat your diarrhea. If it is constipation, treat the constipation. If it is flatulence, bloating, treat that. So, but there's not one medication that will say, yeah, it works for everyone. It's all about trial and error.
That's it.
So, honestly, IBS is a common condition and a real condition. That would be my take-home message. What is your take-home message?
Well, I think we've discussed this at length, where we've sort of like talked about what IBS is and what are the symptoms to look out for. But it is also very crucial that anyone with IBS should work with a healthcare professional, a healthcare provider, to come up with a personalized, tailored treatment plan. So it's more of knowing, okay, when this happens, this is what you need to take. And when you are having certain foods and this is causing a trigger, this is what you need to do. So this will, of course, help with sort of managing symptoms, as well as also identifying triggers. And I think identifying triggers is the most crucial thing when it comes to IBS, because let's be honest, triggers can vary widely. So something that could be a trigger with one person might not necessarily be a trigger with someone else. So knowing what your triggers are is very, very important, and avoiding this triggers. So having a personalized treatment plan and also identifying your triggers, these are very, very crucial in managing IBS.
Okay.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.